Okay, next thing we're going to talk about is, again, kind of thinking about how do we target the tissue we want. So the ability for the wave to penetrate a type of tissue versus the likelihood that that type of tissue is going to absorb the energy. So we have this inverse relationship between penetration and absorption. So if the tissue absorbs more energy, it's not going to be as penetrable. Okay, so it's not going to allow the energy to transmit through to get to deeper tissues as easily. If it's more able to do that, to transmit through, it's able to have a higher rate of penetration, then we're less likely to have absorption happening, right? So law of growth of Draper kind of playing into effect there again. So the absorption increases as your frequency also increases. So we've talked about that, right? 3 megahertz is going to absorb more superficially, so it has a high level of absorption early. So the frequency will definitely play a role, but your tissue will also play a role, okay? So tissues high in water content have a low rate of absorption and thus higher penetration, so lower absorption. So fat, very little of the energy is absorbed. So a lot of it allows penetration, allows transmission to deeper tissues, which is great because we're not usually trying to target fat. So inverse that, right? It's the least absorbed, most transmitted. So tissues higher in protein content have a high rate of absorption. So low penetration ability, high absorption ability. So tissues like tendons, ligaments, the you know, most of the things we're trying to target, fascia of the muscle, all those are really high in protein content and have a lot of absorption ability. Now, muscle itself is a little tricky because muscle has both protein as well as water content, plus it has a lot of blood flow. And so heat gets dispersed pretty easily within the depth of the muscle tissue. We can target all of the fascia around the muscle, but we get less heating inside the belly of the muscle as we would maybe think, based on the level of protein that it has in there. Peripheral nerves, energy is absorbed about twice the rate of muscle, so it's really significant amount of absorption there. Superficial bone has a lot of energy absorption, okay? And so because it takes those longitudinal waves and turns them into transverse waves, it's more efficient in its absorption than kind of even any other tissue, which that is another reason that, and we'll talk about standing waves here in a minute, of why we keep the ultrasound head moving. We do have some energy that scatters due to reflection or refraction. And all of this has to do with what's known as the acoustic impedance. So the tissue density, times the speed of transmission, determines how much is going to be reflected and how much gets transmitted, how much is going to be absorbed. So more energy will be transmitted if the two densities are closer to each other, okay? If there's high acoustic impedance, we're going to have more reflection happening, that we'll talk about in a minute. So when we talk about absorption taking place, we're talking about the fact that the sound waves, that energy gets converted from mechanical energy into the thermal energy. And so again, the amount of absorption is related to the amount of collagen or protein in the tissue. So high water content means high transmission, high protein content means high absorption. Reflection occurs usually when we have dramatic changes in density areas, and we'll talk about those. And then we get a lot more refraction or bending of the wave as it passes through joint spaces, and that can also produce what we call standing waves. So reflection versus transmission, okay? So from the transducer to the air, we get about 98% of the energy to be reflected. It's almost completely reflected, which is why we need, okay, some sort of conducting mechanism. In this case, usually gel or potentially water. Through fat, we get a lot of transmission, which is good because we're not usually trying to treat fat. So we transmit through that fat because it has a high water content. At the muscle-fat interface, however, we get a lot of reflection and refraction as well because of that change in density that occurs. And then at a soft tissue bone interface, okay, so we said superficial bone will end up absorbing really a lot of that energy because it will transfer to those transverse waves. But at that initial point of transition between soft tissue and bone, we get a lot of reflection as well. And what happens when we hit that bone, we get what the reflection ends up coming back almost the same direction as the initial input. And so those reflective waves end up meeting the incoming waves and create what we call as a standing wave, which means we have this really kind of concentrated area of really significant increase in intensity. So we get really high peaks, low troughs, and that increase in density or intensity gets magnified by these high and low pressure areas that are happening in the sound wave. Gas bubbles tend to towards the low pressure areas. Cells tend to collect at the high pressure areas. And so we can get a significant increase in the level of energy where we have this reflection taking place in these standing waves, especially if that's happening in a small space. We have a high risk of tissue damage with that. So this is reason number 2 that we really keep the sound head moving, right? We don't want to create what we call hot spots, okay, where these standing waves occur. So increase in the ultrasound energy that is reflecting off the bone can create periosteal pain. So we want to be careful with ultrasound over bony prominences. So think of like the ankle or on the hand or things like that over the AC joint, because we're going to create a lot more energy because of that superficial bone level. And so we for sure would want to be at 3 megahertz, and we would probably want to watch our intensities pretty closely and also be really communicating with our patient that asking them that the area doesn't get too hot or uncomfortable.